Hi friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, today's lecture we are discuss about pharmacology chapter, Autocoids. So friends, I request you to all please watch this video till the end. Let's start. Topics covered under this video. Which topics we are covered in today's lecture, which are as follows: a definition, histamine receptor, pharmacological actions of histamine, use of histamine, antihistaminics, classification of antihistaminics, and detailed study about prostaglandin. Let's start one by one. In details, autocoids. A definition of autocoids. It is derived from two Greek words. Auto means self and akos means medicinal agent or remedy. These are the local hormones with high biological activity and naturally found in the body in inactive form. They differ from the hormones as they get produced in the tissue and hormones get secreted by glands. Example of autocoids is histamine, serotonin, and prostaglandin. Next point, histamine. It is one of the potent biogenic amine. It is one of the potent biogenic amine. It gets synthesized from amino acid histidine. It is stored in mast cells in inactive form. It gets released and become active when there is damage to the cells. Some drugs like morphine, dust particles, injury, cold, heat, UV rays, etc. cause damage to the mast cells. Histamine receptors. There are two histamine receptors, that is H1 receptors and H2 receptors. H1 receptors are present in smooth muscles of different organs. Stimulation of these receptors causes contraction of smooth muscles and increase in mucus secretion. And H2 receptors are present in gastric glands. Stimulation of these receptors causes an increase in gastric acid secretion. H1 receptors are present in smooth muscles and H2 receptors are present in gastric glands. Next point, pharmacological actions of histamine. There are following actions of histamine: action on blood vessels and blood pressure, triple response, action on smooth muscles, action on gastric glands. Let's see one by one action in details. Action on blood vessels and blood pressure. Histamine produces dilation of coronary blood vessels and leads to hypotension. This hypotension can be treated by using adrenaline injection. If it is not treated, it may lead to death. Second action, triple response. The local application or injection of histamine produces a typical response known as triple response. This response is made up of three phases, which are flush, flare, and wheal. Now, flush means reddening at the site of injection. Flare, development of patches. Wheal, development of edema due to release of fluid from the tissue. These are the triple response. Next action, action on smooth muscles. Histamine produces the action on smooth muscles by acting on H1 receptors. It produces contraction of bronchial and uterine smooth muscles. It leads to bronchospasm, hence contraindicated in asthma. Action on gastric glands. Histamine acts on the H2 receptors present in the gastric glands. It causes contraction of intestinal smooth muscles and leads to increase in the secretion of gastric acids. Due to increased secretion of hydrochloric acid, there are chances of development of peptic ulcer. Hence, histamine causes dilation of cerebral blood vessels and causes throbbing headache. Adverse effect of histamine. Following are the some adverse effects of histamine. These are throbbing headache, hypotension, dysphonia, diarrhea, and flushing. Next point, therapeutic uses of histamine. Histamine is used in the study of secretion of gastric glands. It is used in an investigation of allergy. It is used in the diagnosis of leprosy. Route of administration of histamine, subcutaneous route. Contraindications of histamine. Histamine is contraindicated in asthma and peptic ulcer. Next main point, antihistaminics. Definition. The agents which when administered externally antagonize the effects of histamine by acting on H1 and H2 receptors are known as antihistaminics. Example, diphenhydramine, ranitidine, etc. What is antihistaminics? The actions of histamine can be antagonized by following ways. By increasing the destruction of histamine with the help of histaminase enzyme. Second method, by using a physiological antagonist. In this mechanism, the drug given is having an opposite action to that of histamine by acting on non-histaminic receptors. Such an antagonist is known as non-specific physiological antagonist. Example, adrenaline. A third method, by using competitive antagonist. The action of histamine can be antagonized by using the drug which blocks the H1 and H2 receptors. Such drugs are known as antihistaminics. Classification of antihistaminics, there are two main class, H1 receptor antagonist and H2 receptor antagonist. In H1 receptor antagonist, example, diphenhydramine and bromodiphenhydramine. And the example of H2 receptor antagonist, which are also called as anti-secretory agents, example, cimetidine, ranitidine, omeprazole, and promethazine. These are the simple classification of antihistaminics. Next point, pharmacological actions of antihistaminics. Antihistaminic action, action on CNS, local anesthetic action, autonomic effects, and miscellaneous action. What is antihistaminic action? Antihistaminic drugs blocks the action produced by the histamine. Histamine like allergy, vasodilation, triple response, contraction of smooth muscles, headache, and hypotension. Action on CNS. They are normally sedative. They depress the vomiting center present in the CNS. Hence, they can be used in the treatment of motion sickness, means vomiting during traveling. They are also used in the female for treating the vomiting of early pregnancy. Antihistaminic gives anesthetics, local anesthetics action by blocking the sodium ion channel. Autonomic effects, antihistaminics has anticholinergic property. They produce atropine-like actions which causes dryness of mouth. Miscellaneous actions. These drugs are cardiac depressants, hence can be used in the treatment of cardiac arrhythmia. This drug produces synergistic effect with some CNS depressants like alcohol. Hence, their combination with alcohol should be avoided. Some of these drugs are teratogenic, means fetal abnormality. Therapeutic uses of antihistaminics. It is used as sedative hypnotics for treating allergic conditions, for suppression of sneezing, in the treatment of cardiac arrhythmia, in the treatment of nausea and vomiting during pregnancy, in the treatment of motion sickness, vomiting during traveling, in the treatment of asthma as a free anesthetic medication, and in the treatment of peptic ulcer. Prostaglandin. What is prostaglandin? Prostaglandin get synthesized from arachidonic acid by the action of the enzyme prostaglandin synthetase, which present in the prostate gland in the reproductive system, liver, and kidney. Prostaglandin get synthesized from arachidonic acid by the action of the enzyme prostaglandin synthetase, which present in the prostate gland in the reproductive system, liver, and kidney. They show different effects on different organs. They are inflammatory in nature. On the basis of their chemical nature, they can be divided into 6 groups, A, B, C, D, and E, and F. The inhibitors of prostaglandin synthetase are clinically used as an analgesic, antipyretic, and anti-inflammatory. Action of prostaglandin. There are 4 actions. First one, in reproduction, the prostaglandin is mainly involved in erection, ejaculation, and sperm motility in males. In females, it is responsible for uterine and fallopian tube contractility. Action on cardiovascular system. Prostaglandin causes vasodilation and thus produces decrease in blood pressure. Third main action, action on GIT. It reduces the gastric acid secretion and thus protects the gastric mucosa. And fourth action as a transmitter in CNS. Therapeutic uses of prostaglandin. There is main one uses for induction of labor. Thank you guys for watching full video. Please like, share, and subscribe to our YouTube channel for the pharmacy related videos. Thank you guys.